Coluracetam. This is in the racetam family. I think it's worth talking about because I think it does have some benefits, so I'm not going to give it an Agresti down. I'm kind of neutral to positive on this one. I did a video on Prevacetam, right? It's marketed as something to help your memory, learning, and cognition. This is another racetam. It's in the racetam family. Coluracetam. So there are 19 members of the racetam family. This one came out in 2005 from Mitsubishi Tanabe in Japan, and then Brain Cells Inc. brought it to the US, I think like 2010. They eventually wound up going bankrupt, but just anecdotally, patients have come to me on this drug. What is it used for? What's the good of Coluracetam? I've had people tell me mood elevating, increased sociability. It helps people with schizophrenia, decreases anxiety, decreases depression. It actually heightens your visual experience and sound experience, but more visual. They call it high def vision. Forms, lights, shapes become very vivid and acute, and it definitely improves your vision. There is some belief that it helps with, it has neuroprotective effects and may cause neural growth, help with neural pathways grow. So what did I go through? Sociability, anxiety, depression, helps with schizophrenia, helps with vision, helps with sociability, helps with cognition, memory, word finding, may help with level of alertness. That's a good. Side effects that I've heard about, headache is a big one, and nausea, vomiting. It may cause drowsiness. What's the dose of this compound? Usually 10 to 20 milligrams at a time. I've seen people take 10 to 20 milligrams 3 times a day. That's a good start. Start low. You don't know how you'll tolerate it. Also with this, the highest dose in a day is that I've seen is 240 milligrams, 80 milligrams 3 times a day. I would not go that high. 20 milligrams 3 times a day, start with that. After 7 days, tolerance may develop. At higher doses, if you start too high and get greedy, you'll get drowsy, tingling your fingers, nausea, vomiting, headache. It has interactions with opiates, stimulants, antidepressants, alcohol, which could cause drowsiness. You get yourself into trouble. Some serious blackouts, aspiration pneumonia, so be careful. When you take this compound, since it is fat soluble, take it with a high-fat meal, like peanuts are the best one. Cashews work, avocado, but you must take it with some high-fat compound. Take it with peanuts. And also, when you take this, take it with choline. Food products with choline are meat, dairy, chicken, salmon, Brussels sprouts, peanuts. What else? That's about it. There's something called alpha GPC. Stack this compound with alpha GPC, which is a choline containing supplement. If you don't, you'll get headaches. So stack Coluracetam with alpha GPC or foods high in choline. There's something else, this drug, that I should mention. It makes you more mindful and it makes you meditate better. It makes you have a sense of serenity and peace. How does it work? The mechanism of action, it affects glutamate. Glutamate, remember, it increases the sensitivity to glutamate at the AMPA receptor. Do you know what else does that? Esketamine, Spravato. That was the one that's used for the treatment of depression. So this does have mood elevating effects because of that. Also what it does, how it improves cognition and memory. I've done lectures on acetylcholine. This drug increases acetylcholine in the intersynaptic cleft. It's something called the high affinity choline uptake HAKU. It increases the synthesis of acetylcholine and sensitizes the receptors for acetylcholine in the hippocampus. What does that do? That's where memories, working memory, that's the part of the brain involved in that. So it increases acetylcholine, both at sensitivity at the receptor and the amount in the intersynaptic cleft where acetylcholine is effective. Remember, Alzheimer's dementia is problems with acetylcholine, low levels of acetylcholine, or problems at the acetylcholine receptor. This increases acetylcholine, and it increases glutamate sensitivity. These are the two mechanisms of actions that coluracetam work. What type should you use? Use the sublingual type. It's a liquid that goes under your tongue. Why would you do that? If you take something and take a pill and it goes in your stomach, the stomach has veins that go right to the liver and break the molecule down. If you absorb it directly under your tongue into your system, it goes in your bloodstream before it goes into your liver, thus preventing the first pass phenomenon of metabolism by the liver before it enters the bloodstream. I've had people tell me when they take it, there's anecdotal reports that they can see their vision, they can see, their mood is better, they're more sociable, they like the acuity of objects, the sound is better, they're more social, and they're less depressed and less anxious. Don't get greedy, 10 to 20 milligrams, start with that. This is not a thumbs down, this is not a full thumbs up, because this is a supplement, it hasn't fully been tested in people, but I'm giving it a slight thumbs up. Not a full thumbs up, but I think maybe you could try it, and it has been tested in people and studied in Japan. It seems to be a safe supplement. You could buy it at nootropics.com, get the sublingual formulation. It also comes in a powder. You could mix with a liquid and let it sit under your tongue. I also want to shout out to my friends in Canada for watching my channel. Thank you very much. The UK, Canada are the big watchers of my channel. People in Chicago, hello. And the US overall is the biggest consumer of my videos. You can go to my website at dragresti.com. I'm having a whole series on nootropics coming. There's one coming on NuPep. I'm going to go through more of the racetams. There's 19 of them. I'll evaluate that. And I'm going to be evaluating ashwagandha. And I use these things in my practice. So look forward to that. Thank you, Dr. Mark Agresti, signing off.